Today I'm here to talk about smoking bans and the effects of first and secondhand smoke. How would you feel if you went into your normal checkup with your doctor and you were diagnosed with lung cancer, although you've never smoked a cigarette a day in your life? Smoking bans have proved to reduce the number of smokers as well as the number of cigarettes smoked by a person in a day. First-hand and second-hand smoking are both very harmful. First-hand has led to 5 million deaths per year. Second-hand smoking has caused 46,000 heart disease annually and also has caused 11,000 hospitalizations in children. I feel as though if you are smoking a cigarette, that is your choice, and that's the choice that you're going to make. While secondhand smoke is sometimes not your choice, and sometimes it is. If you're around people that are smoking, then that's completely, honestly, your choice. But I don't feel as though if you're walking down the street and somebody's walking and smoking that you're inhaling it. I don't think that's right. As well as parents smoking with infants in a home and a pregnant woman smoking. I feel as though if this is harmful for our children and even our elderly people, why we would not be trying to do something or put more effort into the prevention of tobacco use. I also feel that if parents are the cause of a serious illness in their child, that they should be penalized for it if they are the ones smoking around them, such as driving in a car if you see parents smoking in the car with their kids all the time. It is said that smoking can cause lung disease or cancer, heart disease, stroke, and other numerous illnesses. In 2010, 19% of all adults were smoking. Also in 2010, Obama signed the Affordable Care Act, the Affordable Care Act Union for Tobacco Prevention, which provides funds in the reduction and prevention of tobacco use, such as for insurance purposes, for buying a patch or gum, instances like that, or new medicines that they're coming out with. It is said that right now, smoking bans affect the workplace and some bars and restaurants, as well as other public places. It is said in most states you cannot smoke in a bar or restaurant anymore, and it is actually said that the revenue in those places has gone up since the smoking ban, which I believe that people do enjoy eating in a clean air. While smoking is optional, breathing is not. Smoking, it reduces healthcare costs. A smoking ban has also helped reduce healthcare costs. It has said to improve productivity in workers, and obviously it helps the environment with cleaner air, less litter, less fire hazard. In 2010, the American Lung Association actually did a study on each state in 4 different categories, including tobacco prevention and spending, cigarette tax, and cessation, as well as smoke-free air. What they did was look at all that the state has been doing to try to improve those areas, how they were doing in every area, and they gave them a grade. I chose to look at Nebraska and Iowa specifically, being they are neighboring states which I live. And gladly enough, they both received an A in the most important category, and that was smoke-free air. As well as 24 states plus the District of Columbia all got an A. So I believe that, and that is fully due to the smoking bans that have gone into place. Although Iowa and Nebraska didn't do well in the other categories, they either got a D or an F in the cigarette tax, cessation, and the prevention control, which I feel like prevention control is almost as important as smoke-free air, because a lot of younger people see smoking as a cool thing, which is not at all. They also did, they gave federal grades to different organizations, such as Food and Drug Administration of Tobacco. They got an A for taking necessary steps towards prevention, such as they are starting to put those graphic images on the cigarette packs that's coming out in the fall of 2012. They also signed their first treaty in prevention of tobacco, and that was in 2005. So they are taking steps to improve. I feel as though a smoking ban would obviously help everyone, including the children and the elderly. I feel if we could get states to take us whole completely smoke-free public areas, what we should do is, I would say on a street corner, or maybe, I don't know, like a bus station, have them that be designated smoking areas, whereas you can't just walk the street. And nowadays, with everyone having a smartphone, they could just make a simple ad, and you could just find your closest smoking area to go smoke a cigarette. It would just be like finding a restroom or your favorite store. I feel, though, now that you've heard all this information, I hope you have an insight on what smoking bans do, how they benefit, some risk factors that are going on. So I'm going to ask you to take a few minutes out of your time and visit www.lung.org. They have a link there for the to protect the Clean Air Act. And all you have to do is simply click on this. It'll take you to a link. You just have to fill out a little bit of information about yourself, name, address, phone number. And there's already a predetermined letter written there, and it goes straight to your legislator of your state. You choose your state, and it'll send them one, and it'll be like a signed petition. And it's just to protect your air and continue having these smoke bans be in effect. Which, because nowadays, like Iowa, does allow smoking in casinos, which is almost one of the last places you can smoke in public in, but it could come back in bars. Bars can try to fight this, and they aren't lasting forever. So I hope that everything worked out great for you. I hope that you learned a lot about smoking, and that you take the time to go to this website and write the letter to your legislator and help protect our air. Thank you.